Question 1. The risk matrix shows a high probability of patient distress and potential for misinterpretation if a serious diagnosis is delivered without adequate emotional support. A physician is meeting with a patient who has just received concerning test results. The patient appears visibly anxious and is repeatedly asking, "Is it bad? Just tell me if it's bad." Which of the following communication techniques best balances the need for accurate information delivery with empathetic patient care in this challenging situation? Option A. Immediately provide a detailed, technical explanation of the diagnosis, focusing on the medical facts to ensure the patient understands the severity. Option B. State that the results are serious and suggest they bring a family member to the next appointment to discuss the implications. Option C. Reassure the patient that everything will be fine and postpone a detailed discussion until they are calmer, without setting a specific time for the follow-up. Option D. Acknowledge the patient's anxiety, validate their feelings, and then gently but clearly explain the diagnosis, offering to answer questions and discuss next steps. Correct answer is D. Acknowledge the patient's anxiety, validate their feelings, and then gently but clearly explain the diagnosis, offering to answer questions and discuss next steps. Explanation. Scenario analysis. This scenario is professionally challenging due to the inherent conflict between a physician's duty to provide accurate medical information and the patient's emotional distress and potential for misinterpretation. The physician must navigate the patient's anxiety while ensuring they understand a serious diagnosis, which requires empathy, clarity, and a tailored communication strategy. The risk matrix highlights the potential for negative outcomes if communication fails, such as patient non-adherence, increased anxiety, or erosion of trust. Correct approach analysis. The correct approach involves acknowledging the patient's emotional state, validating their feelings, and then gently but clearly presenting the diagnostic information. This method aligns with ethical principles of patient-centered care and informed consent, as mandated by the National Board of Medical Examiners Guidelines for Physician Conduct. It prioritizes building trust and ensuring the patient can process the information, even if difficult. This approach respects the patient's autonomy by providing them with the necessary information to make future decisions, while also demonstrating compassion. Incorrect approaches analysis. One incorrect approach would be to immediately dismiss the patient's emotional reaction and focus solely on the technical details of the diagnosis. This fails to acknowledge the patient's human experience and can lead to feelings of being unheard or uncared for, violating the ethical obligation to treat patients with dignity and respect. It also increases the risk of the patient not fully absorbing the critical information due to their heightened emotional state. Another incorrect approach would be to oversimplify the diagnosis to the point of being misleading or to withhold crucial details due to fear of upsetting the patient. This constitutes a failure of transparency and honesty, which are fundamental to the physician-patient relationship and are implicitly required by the National Board of Medical Examiners Standards for Professional Conduct. It undermines informed consent and can lead to detrimental decisions by the patient based on incomplete or inaccurate information. A third incorrect approach might involve deferring the conversation entirely without a clear plan or reassurance, leaving the patient in prolonged uncertainty and anxiety. This demonstrates a lack of proactive patient management and can be perceived as avoidance, which erodes trust and fails to meet the physician's responsibility to guide the patient through difficult medical news. Professional reasoning. Professionals should employ a structured approach to delivering difficult news, often referred to as the Spikes protocol or similar frameworks. This involves setting the stage, assessing the patient's perception, obtaining their invitation to share information, giving knowledge, addressing emotions with empathetic responses, and strategizing and summarizing. The core principle is to balance the delivery of accurate medical information with compassionate and empathetic communication, ensuring the patient feels supported and understood throughout the process. Question 2. Compliance review shows that a physician is considering prescribing a medication known to inhibit a specific enzyme in the gluconeogenesis pathway to manage a patient's hyperglycemia. The physician has identified the primary target enzyme, but has not fully explored the potential downstream effects of this inhibition on other related metabolic processes or the patient's overall hormonal balance. Which of the following represents the most appropriate and ethically sound approach to managing this patient's care? Option A. Prescribe the medication immediately to address the hyperglycemia, as the primary indication is clear and the potential for complex metabolic interactions is likely minimal in most patients. Option B. Initiate the medication and monitor only for the direct reduction in blood glucose levels, deferring any investigation into broader metabolic consequences unless significant adverse events are reported by the patient. Option C. Rely on the patient's previous positive response to similar medications, assuming that the metabolic effects will be comparable and not require further investigation. Option D. Conduct a thorough review of the patient's complete metabolic profile, including hormonal status and other relevant biochemical markers, and research the known and potential downstream effects of the proposed medication on interconnected metabolic pathways before initiating treatment. The correct answer is D. Conduct a thorough review of the patient's complete metabolic profile, including hormonal status and other relevant biochemical markers, and research the known and potential downstream effects of the proposed medication on interconnected metabolic pathways before initiating treatment. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a physician to balance the immediate needs of a patient with the long-term implications of treatment decisions, particularly when those decisions involve complex metabolic pathways and their regulation. The physician must consider not only the direct impact of a medication on a specific pathway, but also potential off-target effects, drug interaction, and the patient's unique metabolic profile. This necessitates a deep understanding of biochemical principles and their clinical application, as well as adherence to established medical guidelines and ethical considerations regarding patient care and informed consent. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's condition, including a thorough review of their medical history, current medications, and relevant laboratory data. This is followed by a detailed consideration of how the proposed medication interacts with the specific metabolic pathway in question, anticipating potential downstream effects and compensatory mechanisms. The physician then formulates a treatment plan that prioritizes patient safety and efficacy, considering alternative therapeutic options and potential monitoring strategies. This approach aligns with the National Board of Medical Examiners' emphasis on evidence-based practice, patient-centered care, and the physician's responsibility to apply scientific knowledge to clinical decision-making. It reflects a commitment to understanding the intricate biological processes involved in disease and treatment, ensuring that interventions are both targeted and safe. Incorrect approaches analysis. One incorrect approach involves prescribing the medication based solely on its primary intended effect on a single metabolic enzyme, without considering potential broader impacts on related pathways or the patient's overall metabolic state. This failure to conduct a thorough risk-benefit analysis and consider the systemic effects of the drug represents a deviation from best medical practice and could lead to unforeseen adverse events or suboptimal treatment outcomes. Demonstrates a superficial understanding of metabolic regulation and its clinical relevance. Another incorrect approach is to proceed with treatment without adequately informing the patient about the potential metabolic consequences and side effects of the medication. This violates the ethical principle of informed consent, which requires patients to understand the risks, benefits, and alternatives of any proposed medical intervention. A failure to disclose relevant information about how the medication might affect their body's internal processes undermines patient autonomy and trust. A third incorrect approach is to rely on outdated or anecdotal information regarding the medication's effects on metabolic pathways, rather than consulting current scientific literature and clinical guidelines. This can lead to the use of ineffective or even harmful treatments. As medical knowledge and understanding of metabolic pathways are constantly evolving, it demonstrates a lack of commitment to continuous learning and professional development, which are essential for maintaining competence. Professional reasoning. Professionals facing similar situations should employ a systematic decision-making process. This begins with a thorough patient assessment, followed by a deep dive into the scientific literature and relevant clinical guidelines pertaining to the specific metabolic pathway and the proposed intervention. Critical evaluation of the evidence, considering potential benefits and risks, is paramount. Open and honest communication with the patient, ensuring they understand the rationale for the treatment and any potential implications, is an ethical imperative. Finally, a commitment to ongoing monitoring and reevaluation of the treatment plan based on the patient's response and emerging scientific knowledge is crucial for optimal patient care. Question 3. Investigation of a 78-year-old patient with a diagnosis of moderate Alzheimer's disease who, during a routine follow-up, expresses a strong desire to discontinue their current medication regimen for managing symptoms of cognitive decline, stating, "I don't want to take those pills anymore. They make me feel like a zombie." The physician is aware that the patient's family has previously expressed concerns about the patient's safety at home if cognitive function deteriorates further. What is the most appropriate next step for the physician to take? Option A. Proceed with discontinuing the medication as requested by the patient, assuming their expressed desire overrides any potential safety concerns raised by the family. Option B. Immediately inform the patient's family of the patient's request to stop medication and suggest they take over the decision-making process. Option C. Explain to the patient that their Alzheimer's disease affects their judgment and that the medication is necessary for their well-being, proceeding with the current prescription. Option D. Conduct a formal assessment of the patient's decision-making capacity regarding their medication regimen, exploring their understanding of the potential benefits and risks of continuing or discontinuing the medication, and their reasoning behind the request. The correct answer is D. Conduct a formal assessment of the patient's decision-making capacity regarding their medication regimen, exploring their understanding of the potential benefits and risks of continuing or discontinuing the medication, and their reasoning behind the request. Explanation. This scenario presents a professional challenge due to the inherent complexity of managing a patient with a chronic, progressive neurological condition and the ethical imperative to respect patient autonomy while ensuring their safety and well-being. The physician must balance the patient's stated wishes with their evolving capacity to make informed decisions, a common dilemma in geriatric and neurological care. Careful judgment is required to assess the patient's current understanding, the potential risks and benefits of different interventions, and the impact of the condition on their decision-making abilities. The correct approach represents best professional practice by prioritizing a comprehensive assessment of the patient's capacity to consent to the proposed treatment. This aligns with the fundamental ethical principles of autonomy and beneficence, as well as regulatory frameworks governing patient care and informed consent. Specifically, it adheres to the National Board of Medical Examiners' emphasis on patient-centered care and the physician's responsibility to ensure that treatment decisions are made by individuals who understand the nature, purpose, risks, and benefits of the proposed intervention. This approach involves a structured evaluation of cognitive function relevant to the decision at hand, considering factors such as memory, reasoning, and the ability to appreciate the consequences of their choices. An incorrect approach that involves proceeding with the treatment based solely on the patient's initial verbal request, without a current capacity assessment, fails to uphold the principle of informed consent. This could lead to treatment being administered without the patient's true understanding or agreement, violating their autonomy and potentially leading to suboptimal outcomes or patient distress. It also risks contravening regulatory guidelines that mandate a physician's duty to ensure capacity before obtaining consent for medical procedures. Another incorrect approach, that of unilaterally deciding against the patient's wishes based on a presumed lack of capacity without a formal assessment, represents a paternalistic stance that undermines patient autonomy. While the physician has a duty to protect the patient, this duty does not supersede the patient's right to make decisions about their own care, provided they have the capacity to do so. This approach fails to engage the patient in shared decision-making and may erode the therapeutic relationship. A further incorrect approach, that of immediately involving family members in decision-making without first assessing the patient's capacity and exploring their own preferences, bypasses the patient's primary right to self-determination. While family input can be valuable, it should be sought in a manner that respects the patient agency and is contingent upon their consent or documented lack of capacity. This approach risks making decisions for the patient rather than with them. The professional decision-making process for similar situations should involve a systematic approach. First, assess the patient's capacity to make the specific decision at hand. This involves evaluating their understanding of the information provided, their ability to reason and weigh options, and their capacity to communicate a choice. If capacity is present, engage in shared decision-making, respecting the patient's informed choices. If capacity is impaired, involve surrogate decision-makers according to established legal and ethical guidelines, ensuring the patient's best interests are paramount. Throughout this process, clear documentation of assessments and discussions is crucial. Question 4. What factors determine the most effective communication strategy when explaining a new, complex diagnosis and treatment plan to an anxious patient with limited health literacy? Option A. The use of highly technical medical terminology to ensure accuracy and completeness, assuming the patient will seek clarification if needed. Option B. The patient's level of health literacy, emotional state, and the complexity of the medical information, necessitating a tailored approach using clear language, visual aids, and opportunities for questions and confirmation of understanding. Option C. The perceived urgency of the medical condition, focusing on conveying the most critical information without dwelling on patient anxieties or potential misunderstandings. Option D. The physician's personal communication style and the amount of time available for the appointment, prioritizing the delivery of all necessary medical facts efficiently. Correct answer is B. The patient's level of health literacy, emotional state, and the complexity of the medical information, necessitating a tailored approach using clear language, visual aids, and opportunities for questions and confirmation of understanding. Explanation. This scenario presents a common challenge in healthcare, conveying complex medical information to a patient with limited health literacy and significant anxiety. The professional's responsibility extends beyond simply delivering facts. It involves ensuring comprehension, fostering trust, and empowering the patient to participate in their care. The core of effective communication in this context lies in adapting the message to the recipient's understanding and emotional state, a principle deeply embedded in ethical medical practice and patient-centered care guidelines, which are foundational to the National Board of Medical Examiners' assessment of physician competence. The correct approach prioritizes patient understanding and emotional support. It involves using clear, simple language, avoiding jargon, and employing visual aids or analogies to explain the diagnosis and treatment plan. Crucially, it incorporates active listening, allowing the patient to voice concerns and ask questions, and checking for comprehension through teach-back methods. This aligns with the ethical imperative to obtain informed consent, which requires that patients understand the risks, benefits, and alternatives of proposed treatments. Regulatory frameworks emphasize the physician's duty to communicate effectively to ensure patient autonomy and safety. Incorrect approaches fail to adequately address the patient's needs. One incorrect approach might involve overwhelming the patient with technical medical terms and statistics without checking for understanding. This violates the principle of clear communication and can lead to misinterpretations, anxiety, and non-adherence to treatment, potentially contravening guidelines on patient education and informed consent. Another incorrect approach might be to dismiss the patient's anxiety or concerns, focusing solely on the medical facts. This erodes trust and fails to acknowledge the psychological impact of a diagnosis, which is a critical component of holistic patient care and can be seen as a failure to meet professional standards of empathy and support. A third incorrect approach could be to rush the conversation, providing minimal information and not allowing for questions. This not only prevents comprehension, but also signals a lack of respect for the patient's right to information and participation in their healthcare decisions, a fundamental ethical and professional obligation. The professional decision-making process in such situations should involve a continuous assessment of the patient's understanding and emotional state. This includes preparing for the conversation by anticipating potential questions and concerns, tailoring the language and pace to the individual, actively observing nonverbal cues, and creating a safe space for dialogue. The goal is to move from a paternalistic model of care to a collaborative partnership, where the patient is an informed and active participant in their health journey. Question 5. When evaluating a patient with a history of chronic obstructive pulmonary disease, COPD, who presents with increased shortness of breath, purulent sputum, and fever, which of the following pathophysiological changes is most likely contributing to their acute deterioration? Option A. Pulmonary embolism causing impaired gas exchange. Option B. Progressive alveolar destruction leading to decreased lung compliance. Option C. Interstitial fibrosis thickening the alveolar capillary membrane. Option D. Bronchial inflammation and mucus hypersecretion secondary to infection. Correct answer is D. Bronchial inflammation and mucus hypersecretion secondary to infection. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the clinician to differentiate between a primary disease process and a secondary complication, necessitating a thorough understanding of the underlying pathophysiology and potential interactions. Misinterpreting the cause of the patient's worsening symptoms could lead to inappropriate treatment, delayed diagnosis of the true issue, and potential harm to the patient. The urgency of the situation, coupled with the complexity of the patient's presentation, demands careful clinical reasoning and application of medical knowledge. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's current symptoms in the context of their known disease. This includes a detailed history, physical examination, and targeted diagnostic investigations to identify the specific pathophysiological changes contributing to the deterioration. This aligns with the National Board of Medical Examiners' emphasis on assessing a physician's ability to apply scientific knowledge to patient care, ensuring accurate diagnosis and effective management based on established medical principles and evidence-based practice. The focus is on understanding the disease mechanisms and how they manifest clinically. Incorrect approaches analysis. One incorrect approach would be to solely focus on managing the most obvious symptom without investigating its root cause. This fails to address the underlying pathophysiological changes and could mask a more serious, developing condition, violating the ethical obligation to provide comprehensive care and the professional standard of thorough diagnostic workup. Another incorrect approach would be to attribute the worsening symptoms solely to the natural progression of the known disease without considering alternative or superimposed conditions. This demonstrates a lack of critical thinking and an incomplete understanding of how various pathophysiological processes can interact, potentially leading to misdiagnoses and suboptimal patient outcomes, which is contrary to the rigorous standards expected of physicians. A third incorrect approach would be to initiate aggressive treatment for a presumed complication without confirming the diagnosis through appropriate investigations. This can lead to unnecessary intervention, potential side effects, and a failure to address the actual problem, reflecting a departure from evidence-based medicine and sound clinical judgment. Professional reasoning. Professionals should employ a structured approach to patient assessment, starting with a broad differential diagnosis based on the presenting symptoms and patient history. This should be followed by a focused physical examination and the judicious use of diagnostic tests to confirm or refute hypotheses. A continuous reassessment of the patient's condition and response to treatment is crucial. This iterative process ensures that the clinician remains attuned to evolving pathophysiological changes and adapts management strategies accordingly, upholding the highest standards of patient care. Question 6. The control framework reveals that a physician is evaluating a patient for a complex neurological disorder. Germline genetic testing has been identified as a potentially valuable diagnostic tool, which may also reveal predispositions to other conditions not currently symptomatic. During the informed consent process, the patient explicitly states they do not wish to know about any genetic predispositions to future illnesses, expressing significant anxiety about such information. The physician is now considering how to proceed with the genetic testing and the communication of results. Which of the following approaches best upholds ethical and professional standards in this context? Option A. Engage in a further in-depth discussion with the patient about the implications of genetic predispositions, offering genetic counseling, and respecting their right to decline knowledge of specific results, while proceeding with testing that can be interpreted in a way that honors their wishes. Option B. Decline to perform the genetic testing altogether, as the patient's expressed anxiety about potential results suggests it would be too distressing and potentially harmful. Option C. Proceed with the genetic testing, and upon receiving the results disclose all findings, including any genetic predispositions to other conditions, regardless of the patient's prior expressed wishes, emphasizing the potential for future health management. Option D. Proceed with the genetic testing, and upon receiving the results, discuss only those findings directly pertinent to the patient's current neurological condition, intentionally withholding any information about unrelated genetic predispositions. Correct answer is D. Proceed with the genetic testing, and upon receiving the results, discuss only those findings directly pertinent to the patient's current neurological condition, intentionally withholding any information about unrelated genetic predispositions. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a physician's duty to inform a patient about potentially life-saving diagnostic information and the patient's expressed desire to not know certain genetic predispositions. The physician must navigate patient autonomy, the ethical imperative of beneficence, and the potential for psychological distress associated with genetic information. The application of molecular biology techniques, specifically germline genetic testing, introduces a layer of complexity regarding the interpretation and communication of results that may have implications beyond the immediate clinical question. Correct approach analysis. The correct approach prioritizes patient autonomy and informed consent. It involves a thorough discussion with the patient about the implications of the genetic testing, including the possibility of incidental findings, and respecting their right to decline specific information. This aligns with the ethical principles of respect for persons and non-maleficence, as forcing unwanted information upon a patient can cause significant distress. The physician's role is to facilitate informed decision-making, not to unilaterally decide what a patient should or should not know, especially when the information is not immediately actionable for their current condition. This approach is supported by guidelines from professional medical organizations that emphasize shared decision-making and patient-centered care. Incorrect approaches analysis. One incorrect approach involves proceeding with the genetic testing and disclosing all findings, regardless of the patient's prior expressed wishes. This violates the principle of patient autonomy and can lead to iatrogenic harm by causing undue anxiety or distress. It disregards the patient's right to control their own medical information and make decisions about what they are prepared to handle emotionally and psychologically. This action could be seen as a breach of trust and a failure to uphold the ethical duty of non-maleficence. Another incorrect approach is to withhold the genetic testing altogether due to the patient's reluctance to receive potentially distressing information. While seemingly protective, this can be paternalistic and may deny the patient access to information that could be beneficial for their future health management or that of their family members, even if they are not currently ready to receive it. The physician should explore the reasons for the patient's reluctance and offer support and counseling rather than making a decision that removes potential options for the patient. A third incorrect approach is to perform the testing and only disclose information that is directly relevant to the patient's current presenting illness, while intentionally omitting any genetic predispositions. This is ethically problematic because it involves a deliberate withholding of potentially significant health information, even if not immediately actionable. It undermines the principle of full disclosure and can lead to a situation where the patient is not fully informed about their own health landscape, potentially impacting future health decisions or preventative measures. Professional reasoning. Professionals facing similar situations should employ a structured decision-making process. First, they must clearly identify the ethical principles in conflict, autonomy vs. beneficence, non-maleficence. Second, they should engage in open and empathetic communication with the patient to understand their concerns and motivations. Third, they should explore all available options, including phased disclosure, genetic counseling, and the possibility of re-evaluating the decision at a later time. Fourth, they must document the discussion thoroughly, including the patient's expressed wishes and the rationale for the chosen course of action. Finally, they should consult with colleagues or ethics committees if the situation is particularly complex, or if there is significant doubt about the best course of action. Question 7. Cost-benefit analysis shows that for a young child presenting with symptoms suggestive of a urinary tract infection, initiating diagnostic workup with the least invasive, most readily obtainable sample is generally preferred. Considering this principle and the specific needs of pediatric patients, which of the following initial diagnostic approaches is most appropriate? Option A. Obtain a clean catch urine sample with appropriate caregiver assistance and collection techniques. Option B. Rely solely on a urine dipstick urinalysis without obtaining a culture. Option C. Immediately proceed with suprapubic aspiration of urine. Option D. Perform a bladder scan to estimate residual urine volume. The correct answer is A. Obtain a clean catch urine sample with appropriate caregiver assistance and collection techniques. Explanation. This scenario presents a common challenge in pediatric care, balancing the need for accurate diagnostic information with the inherent distress and potential harm associated with invasive procedures in young children. The professional challenge lies in selecting the least burdensome, yet most effective diagnostic method, considering the child's developmental stage, pain tolerance, and the potential for psychological impact. Careful judgment is required to avoid unnecessary trauma while ensuring a timely and accurate diagnosis. The correct approach represents best professional practice because it prioritizes non-invasive, age-appropriate techniques that minimize patient discomfort and anxiety. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Specifically, for pediatric patients suspected of having a urinary tract infection, a clean catch urine sample is the preferred initial diagnostic method. This technique is less invasive than catheterization, requires less specialized equipment, and can be performed in a less clinical setting, thereby reducing stress for both the child and the caregiver. The National Board of Medical Examiners emphasizes evidence-based practice and patient-centered care, which includes employing the least restrictive means necessary to achieve diagnostic goals. An incorrect approach would be to immediately proceed with suprapubic aspiration without attempting less invasive methods. This is a more invasive procedure, associated with greater discomfort, risk of complications, and potential for significant psychological distress in a young child. Ethically, this fails to adhere to the principle of proportionality, where the invasiveness of a procedure should be commensurate with the diagnostic certainty and clinical urgency. Regulatory guidelines, while not explicitly detailing every diagnostic step, implicitly support the use of standard, evidence-based protocols that begin with less invasive options. Another incorrect approach would be to rely solely on a dipstick urinalysis without obtaining a culture, especially in certain pediatric populations or with specific clinical presentations, as this may lead to delayed or inaccurate treatment decisions, potentially causing harm. This fails to meet the standard of care for definitive diagnosis and management of UTIs in children. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's age, developmental stage, clinical presentation. In the diagnostic question, a tiered approach to diagnostic testing, starting with the least invasive and most readily available methods, should be employed. This involves considering the potential benefits of each test against its risks, invasiveness, and the likelihood of yielding useful information. Collaboration with caregivers is also crucial, as their understanding and cooperation can significantly impact the success of diagnostic procedures and the overall patient experience. Question 8. The monitoring system demonstrates that a patient who has undergone a recent diagnostic imaging study is repeatedly asking the physician to confirm their belief that their spleen is located on the right side of their abdomen, despite the imaging clearly showing it in its normal anatomical position on the left. The physician knows the patient has a strong personal conviction about this anatomical placement. Option A. Provide a highly technical explanation of splenic embryological development and vascular supply, assuming this will eventually correct the patient's misconception. Option B. Gently explain to the patient that while their conviction is understood, the imaging and anatomical knowledge confirm the spleen is located on the left side of the abdomen, and offer to review the imaging with them to clarify. Option C. Agree with the patient's assertion about the spleen's location to avoid causing distress and maintain patient rapport. Option D. State directly that the patient is incorrect about the spleen's location and refuse to discuss it further, as it is a factual matter. Correct answer is B. Gently explain to the patient that while their conviction is understood, the imaging and anatomical knowledge confirm the spleen is located on the left side of the abdomen, and offer to review the imaging with them to clarify. Explanation. This scenario presents a professional challenge due to the conflict between a physician's duty to provide accurate information and the patient's expressed desire for a specific, albeit medically inaccurate, diagnosis. The physician must navigate the ethical imperative of patient autonomy against the professional obligation to uphold medical truth and prevent harm. The gross anatomy of the major organ systems is central here, as the physician's understanding of these structures informs the accurate diagnosis and prognosis. The correct approach represents best professional practice because it prioritizes patient well-being and informed consent while maintaining professional integrity. By gently correcting the patient's misconception about their anatomy and explaining the actual findings, the physician upholds the principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, which in this case includes the harm of false hope or misunderstanding. This approach also respects patient autonomy by providing them with accurate information upon which to base their understanding and future decisions, even if it contradicts their initial belief. The National Board of Medical Examiners emphasizes the importance of clear, truthful communication in patient care. An incorrect approach that involves simply agreeing with the patient's inaccurate anatomical understanding would be professionally unacceptable. This would violate the principle of non-maleficence by allowing the patient to operate under a false premise, potentially leading to inappropriate self-treatment, anxiety, or delayed appropriate care. It also undermines the physician's professional responsibility to provide accurate medical information, a core tenet of medical practice, and a standard expected by the National Board of Medical Examiners. Another incorrect approach, that of abruptly dismissing the patient's understanding without explanation, would be professionally unacceptable. While truthful, it fails to respect the patient's dignity and can damage the therapeutic relationship, hindering future communication and trust. This approach neglects the importance of empathy and patient-centered communication, which are crucial for effective medical care and are implicitly assessed in the National Board of Medical Examiners' evaluation of clinical judgment. A further incorrect approach, that of providing a vague or overly technical explanation that the patient cannot comprehend, would also be professionally unacceptable. While the physician may be technically correct, the failure to communicate effectively renders the information useless and can lead to frustration and misunderstanding, ultimately failing to serve the patient's best interest or uphold the physician's duty of care. The professional decision-making process for similar situations involves a careful assessment of the patient's understanding, their emotional state, and the potential impact of different communication strategies. It requires balancing the physician's knowledge with the patient's perspective, employing empathy, and prioritizing clear, truthful, and understandable communication to foster trust and ensure the best possible patient outcomes. Question 9. Benchmark analysis indicates that a patient presents with persistent, debilitating knee pain and significant functional limitations, yet initial radiographic and MRI evaluations reveal no structural abnormalities or inflammatory markers suggestive of common orthopedic pathologies. The physician has conducted a thorough initial workup. Which of the following approaches best reflects sound clinical reasoning and decision-making in this complex scenario? Option A. Reevaluate the patient's history and physical examination findings. Consider a broader differential diagnosis including less common etiologies or referred pain, and explore further diagnostic avenues based on a refined hypothesis. Option B. Conclude that the symptoms are likely psychosomatic and refer the patient for psychological counseling without further medical investigation. Option C. Immediately order advanced imaging techniques such as a PET scan or a more extensive battery of blood tests to search for rare systemic diseases. Option D. Dismiss the patient's reported pain as subjective and advise them to manage with over-the-counter analgesics, as objective findings are negative. The correct answer is A. Reevaluate the patient's history and physical examination findings. Consider a broader differential diagnosis including less common etiologies or referred pain, and explore further diagnostic avenues based on a refined hypothesis. Explanation. Scenario analysis. This scenario presents a common yet challenging clinical situation where a patient's subjective report of pain and functional limitation conflicts with objective diagnostic findings. The challenge lies in reconciling these discrepancies to formulate an effective and ethical treatment plan, ensuring patient well-being and adherence to professional standards of care. The physician must navigate potential biases, consider the holistic patient experience, and avoid premature closure of diagnostic reasoning. Correct approach analysis. The correct approach involves a systematic and iterative process of clinical reasoning. It prioritizes a comprehensive reevaluation of the patient's history, a thorough physical examination, and consideration of differential diagnoses that might explain the persistent symptoms despite negative initial investigations. This approach aligns with the National Board of Medical Examiners' emphasis on thoroughness, patient-centered care, and the application of sound medical judgment. It reflects the ethical obligation to provide care that is both scientifically sound and responsive to the patient's lived experience, acknowledging that diagnostic tools have limitations and that complex conditions can present atypically. This iterative process ensures that all avenues are explored before settling on a diagnosis or treatment plan, minimizing the risk of misdiagnosis or undertreatment. Incorrect approach is analysis. One incorrect approach is to dismiss the patient's reported symptoms based solely on negative objective findings. This fails to acknowledge the subjective nature of pain and the limitations of diagnostic tests, potentially leading to patient distrust, non-adherence, and undertreatment of a genuine condition. Ethically, it violates the principle of beneficence by not acting in the patient's best interest and can be seen as a failure to uphold the physician's duty of care. Another incorrect approach is to immediately escalate to more invasive or expensive investigations without a clear diagnostic rationale or a structured reevaluation. This can lead to unnecessary patient risk, increased healthcare costs, and may not address the underlying cause if the initial diagnostic thinking was incomplete. It represents a departure from judicious resource utilization and a failure to apply a systematic problem-solving approach. A third incorrect approach is to attribute the symptoms to psychological factors without a thorough exclusion of organic causes. While psychological factors can influence pain perception and functional status, this conclusion should only be reached after a comprehensive medical workup has been completed and other explanations have been reasonably ruled out. Prematurely labeling symptoms as psychosomatic can be dismissive and lead to inadequate medical management. Professional reasoning. Professionals should employ a structured approach to clinical reasoning, beginning with a broad differential diagnosis, systematically gathering information through history and physical examination, utilizing diagnostic tests judiciously, and continuously reevaluating the differential as new information emerges. This involves active listening, empathy, and a commitment to understanding the patient's perspective, while simultaneously applying scientific knowledge and critical thinking to arrive at the most accurate diagnosis and effective treatment plan. The process is iterative, allowing for adjustments based on evolving clinical data and patient response. Question 10. The audit findings indicate a need to refine the process for evaluating new infectious disease consultations, specifically concerning the interpretation of laboratory results related to pathogenic mechanisms and virulence factors. A recent case involved a patient presenting with severe symptoms, and the initial laboratory report identified a common bacterium. However, the attending physician's subsequent risk assessment and treatment plan seemed disproportionate to the typical presentation of this bacterium. The audit team is questioning whether the physician adequately considered the specific pathogenic mechanisms and virulence factors that might be contributing to the patient's severe illness, beyond simply identifying the organism. Which of the following approaches best reflects the required depth of analysis for such a scenario, ensuring accurate risk assessment and appropriate clinical decision-making according to established medical practice guidelines? Option A. Assume the patient's severe presentation is due to a co-infection with a more virulent organism, even if not initially detected, and initiate broad-spectrum empirical treatment. Option B. Rely on the physician's prior experience with similar bacterial infections to determine the severity and appropriate management, without needing to delve into specific virulence factor details. Option C. Prioritize identifying the specific virulence factors of the isolated pathogen that are known to contribute to severe disease presentations, and correlate these with the patient's clinical signs and symptoms to refine the risk assessment. Option D. Focus on the antibiotic susceptibility profile of the identified pathogen to guide treatment, as this is the most critical factor in managing severe infections. The correct answer is C. Prioritize identifying the specific virulence factors of the isolated pathogen that are known to contribute to severe disease presentations, and correlate these with the patient's clinical signs and symptoms to refine the risk assessment. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the clinician to interpret complex microbiological data in the context of patient presentation and potential treatment implications, all while adhering to established diagnostic and reporting protocols. The challenge lies in accurately identifying the pathogenic mechanism and relevant virulence factors to inform appropriate risk assessment and patient management, ensuring that the diagnostic process is both thorough and efficient. Correct approach analysis. The correct approach involves a systematic review of the identified pathogen's known virulence factors and their correlation with the observed clinical manifestations. This aligns with best professional practice by prioritizing evidence-based interpretation of laboratory results to guide clinical decision-making. Specifically, understanding how a pathogen's toxins, adhesins, or immune evasion strategies contribute to disease severity allows for a more precise risk assessment, informing the urgency of intervention and the selection of targeted therapies. This approach is ethically sound as it promotes patient well-being through accurate diagnosis and effective management, and it adheres to professional standards of care that mandate thorough evaluation of diagnostic findings. Incorrect approaches analysis. One incorrect approach would be to solely focus on the presence of the pathogen without considering its specific virulence factors. This is professionally unacceptable because it oversimplifies the diagnostic picture and can lead to underestimation of disease severity or inappropriate treatment strategies. For example, a pathogen might be present but in a non-virulent strain, or its virulence factors might not be expressed under the current conditions. This failure to conduct a deep analysis of pathogenic mechanisms can lead to suboptimal patient care and potential harm, violating the ethical principle of non-maleficence. Another incorrect approach would be to prematurely conclude the risk assessment based on initial, incomplete data without further investigation or consultation. This is professionally unsound, as it bypasses the necessary due diligence required for accurate risk stratification. It can result in delayed or incorrect management decisions, potentially exposing the patient to undue risk or failing to provide necessary aggressive treatment. This approach demonstrates a lack of professional rigor and can be seen as a breach of the duty of care owed to the patient. A third incorrect approach would be to rely solely on anecdotal experience or generalized knowledge about the pathogen without consulting current literature or laboratory-specific data on virulence factor expression. While experience is valuable, it must be supplemented by up-to-date information. This can lead to outdated or inaccurate assessments, as understanding of virulence factors and their clinical significance evolves. This failure to stay current with scientific advancements can compromise the quality of care and is ethically problematic as it may not represent the best available evidence for patient management. Professional reasoning. Professionals should adopt a structured approach to risk assessment involving pathogenic mechanisms and virulence factors. This begins with a thorough review of the laboratory report, identifying the specific pathogen. Next, the clinician must access and critically evaluate current scientific literature and reliable databases to understand the known virulence factors of that pathogen and their typical clinical manifestations. This information should then be integrated with the patient's specific clinical presentation, including signs, symptoms, and relevant medical history. The clinician should then synthesize this integrated information to perform a nuanced risk assessment, considering the potential severity of illness, likelihood of complications, and appropriate therapeutic interventions. If there is any ambiguity or uncertainty, consultation with infectious disease specialists or further diagnostic testing should be pursued. This systematic, evidence-based, and patient-centered approach ensures that diagnostic findings are translated into effective and ethical patient care. Question 11. Risk assessment procedures indicate that a patient presents with signs of a severe soft tissue infection. A gram stain of the wound exudate reveals pleomorphic, gram-negative rods. Considering the potential for both aerobic and anaerobic involvement, which of the following approaches best guides the initial management strategy? Option A. Initiate broad-spectrum antibiotics targeting common aerobic gram-negative pathogens and await culture and sensitivity results. Option B. Obtain a gram stain and consider the morphology and gram reaction of the observed bacteria, along with their likely oxygen requirements, to guide initial empirical antibiotic selection and specimen handling. Option C. Prioritize empirical therapy with antibiotics effective against anaerobic gram-negative bacteria, assuming this is the primary driver of the severe infection. Option D. Rely solely on the patient's reported history of recent travel to a tropical region to select empirical antibiotics. Correct answer is A. Initiate broad-spectrum antibiotics targeting common aerobic gram-negative pathogens and await culture and sensitivity results. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the clinician to differentiate between bacterial classifications based on their gram stain and oxygen requirements, which directly impacts the selection of appropriate antimicrobial therapy and infection control measures. Misclassification can lead to delayed or incorrect treatment, potentially worsening patient outcomes and contributing to the spread of resistant organisms. The urgency of patient care necessitates rapid and accurate diagnostic interpretation. Correct approach analysis. The correct approach involves accurately identifying the bacterial morphology and gram-stain characteristics, e.g., gram-positive cocci, gram-negative rods, and correlating this with the likely oxygen requirements, aerobic, anaerobic, facultative, anaerobic. This information is crucial for narrowing down the differential diagnosis and guiding initial empirical treatment. For instance, gram-positive cocci in clusters might suggest Staphylococcus, while gram-negative rods could point towards Enterobacteriaceae. Understanding oxygen requirements is vital. For example, suspected anaerobic infections require specific antibiotics and potentially different specimen handling to avoid oxygen exposure that could kill the bacteria. This aligns with standard clinical microbiology practices and infection control guidelines, which emphasize accurate identification for effective management. Incorrect approach is analysis. One incorrect approach would be to solely rely on the patient's symptoms without considering the gram stain and oxygen requirements. This is a failure because symptoms can be nonspecific and overlap across various bacterial infections. Without laboratory data, treatment would be purely speculative, violating the principle of evidence-based medicine and potentially leading to broad-spectrum antibiotic use without justification, contributing to antimicrobial resistance. Another incorrect approach would be to assume all gram-negative rods are treated with the same class of antibiotics, irrespective of their oxygen requirements. This is flawed because different gram-negative bacteria have varying susceptibilities and mechanisms of resistance, and their oxygen needs can dictate the site and severity of infection. For example, an anaerobic gram-negative rod would necessitate different therapeutic considerations than an aerobic one. A third incorrect approach would be to prioritize treatment based on patient history alone, ignoring the gram stain and oxygen requirement data. While patient history is important, it cannot substitute for microbiological findings in determining the causative agent and its characteristics. This approach risks misdiagnosis and inappropriate therapy, failing to adhere to established diagnostic and treatment protocols. Professional reasoning. Professionals should employ a systematic approach that integrates clinical presentation with laboratory findings. This involves 1. Obtaining a thorough patient history and performing a physical examination. 2. Ordering appropriate diagnostic tests, including gram stain and cultures. 3. Interpreting gram stain results to guide initial empirical therapy and specimen handling. 4. Considering oxygen requirements in conjunction with gram stain and morphology to further refine the differential diagnosis and treatment strategy. 5. Following up with culture and sensitivity results to de-escalate or adjust antibiotic therapy as needed. This iterative process ensures that patient care is guided by the best available evidence and laboratory data, adhering to principles of patient safety and effective antimicrobial stewardship. Question 12. Operational review demonstrates a need to reinforce understanding of fundamental virology principles among clinical staff. Which of the following best describes the process by which viruses replicate within a host cell? Option A. Viruses release preformed virions from infected cells through budding, without requiring internal replication of genetic material or protein synthesis. Option B. Viruses attach to a host cell, enter it, and then utilize the host cell's machinery to synthesize viral nucleic acids and proteins, which are subsequently assembled into new virions before release. Option C. Viral genetic material directly enters the host cell and immediately transforms it into a virus-producing factory without intermediate replication steps. Option D. Viruses replicate independently of host cells by utilizing their own internal enzymatic machinery to produce new viral particles. The correct answer is B. Viruses attach to a host cell, enter it, and then utilize the host cell's machinery to synthesize viral nucleic acids and proteins, which are subsequently assembled into new virions before release. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a physician to interpret complex biological processes related to viral replication in the context of patient care and potential diagnostic or therapeutic interventions. Misunderstanding these fundamental mechanisms can lead to incorrect diagnoses, inappropriate treatment choices, and ultimately, suboptimal patient outcomes. The pressure to make timely and accurate clinical decisions based on scientific understanding necessitates a robust grasp of virology. Correct approach analysis. The correct approach accurately describes the essential steps of viral replication, emphasizing the dependence on host cell machinery for synthesis of viral components and assembly. This reflects best professional practice by demonstrating a foundational understanding of viral pathogenesis, which is critical for interpreting diagnostic tests, understanding disease progression, and evaluating antiviral therapies. Adherence to the scientific principles governing viral replication is implicitly aligned with the National Board of Medical Examiners' mandate to assess a physician's competence in applying scientific knowledge to clinical practice. Incorrect approaches analysis. An approach that focuses solely on the release of preformed virions without acknowledging the preceding replication steps fails to capture the complete viral life cycle and the host cell's role. This is a significant conceptual error that could lead to misinterpretations of viral spread and control. An approach that suggests viruses can replicate independently of a host cell contradicts the obligate intracellular parasitic nature of viruses, a fundamental principle of virology. This misunderstanding would lead to flawed reasoning about disease transmission and prevention. An approach that emphasizes viral genetic material directly transforming host cells without the intermediate steps of replication and assembly overlooks the intricate process of viral reproduction. This simplification omits crucial stages necessary for understanding how viruses propagate and cause disease. Professional reasoning. Professionals should approach questions about viral replication by systematically recalling the established stages of the viral life cycle: attachment, entry, uncoating, replication of viral genome and synthesis of viral proteins, assembly of new virions, and release from the host cell. They should then evaluate how each option aligns with this established scientific understanding, prioritizing accuracy and completeness in describing the process. When faced with uncertainty, consulting reliable, peer-reviewed scientific literature or established textbooks is a crucial step in reinforcing knowledge and ensuring accurate application to clinical scenarios. Question 13. The evaluation methodology shows a physician interviewing a patient presenting with persistent fatigue and generalized malaise. The patient reports these symptoms have been present for several months, with no clear precipitating event. The physician notes the patient appears well-nourished and denies any significant weight loss or fever. The physician is considering common causes of fatigue such as stress or mild anemia. Which of the following approaches best demonstrates the identification of potential red flags in the patient's history? Option A. Asking the patient if they have recently experienced any significant emotional trauma, assuming this is the primary driver of their fatigue. Option B. Focusing solely on the absence of weight loss and fever as indicators that the symptoms are benign. Option C. Probing further for any subtle changes in bowel habits, unexplained bruising, or persistent night sweats, even in the absence of other overt symptoms. Option D. Reassuring the patient that fatigue is common and suggesting lifestyle modifications like increased sleep and reduced stress. The correct answer is C. Probing further for any subtle changes in bowel habits, unexplained bruising, or persistent night sweats, even in the absence of other overt symptoms. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent ambiguity in patient-reported histories, especially when symptoms are vague or potentially influenced by external factors. The physician must balance the patient's subjective experience with objective clinical findings and established medical knowledge, all while adhering to professional standards of care and ethical obligations. The potential for misdiagnosis or delayed diagnosis, with subsequent harm to the patient, necessitates a rigorous and systematic approach to history-taking and red flag identification. Correct approach analysis. The correct approach involves a systematic and comprehensive evaluation of the patient's history, actively seeking out specific details that could indicate a serious underlying condition. This aligns with the National Board of Medical Examiners' emphasis on thorough patient assessment and the physician's ethical duty to provide competent care. Identifying red flags is a critical component of differential diagnosis, ensuring that potentially life-threatening conditions are not overlooked. This proactive approach minimizes the risk of diagnostic error and promotes patient safety, which is a cornerstone of medical practice and regulatory expectations. Incorrect approaches analysis. One incorrect approach involves dismissing the patient's symptoms due to their nonspecific nature without further investigation. This fails to meet the standard of care by potentially overlooking serious pathology. Ethically, it violates the principle of beneficence by not acting in the patient's best interest. Regulatory frameworks, including those overseen by the National Board of Medical Examiners, expect physicians to explore all plausible diagnostic avenues. Another incorrect approach is to focus solely on the most common or benign diagnoses without considering less frequent but more severe possibilities. This represents a failure in critical thinking and diagnostic reasoning, potentially leading to a delayed or misdiagnosis. Such an approach could be deemed negligent if it deviates from accepted medical practice and results in patient harm. A third incorrect approach is to rely heavily on patient self-diagnosis or information from non-medical sources without independent clinical verification. While patient engagement is important, the physician's professional responsibility is to conduct an objective assessment and apply their medical expertise. Over-reliance on unverified information can lead to significant diagnostic errors and compromise patient care, violating the physician's duty to provide evidence-based medical advice. Professional reasoning. Professionals should employ a structured decision-making framework that begins with active listening and empathetic engagement with the patient. This is followed by a systematic, head-to-toe history and physical examination, with a particular focus on eliciting details that could represent red flags for serious conditions. A broad differential diagnosis should be considered, and investigations should be tailored to rule out or confirm the most concerning possibilities. Continuous critical evaluation of findings and patient response is essential throughout the diagnostic process. Question 14. Quality control measures reveal that a patient admitted for pneumonia is exhibiting a sudden and significant drop in blood pressure, accompanied by an increased heart rate and decreased urine output, despite receiving intravenous fluids. The medical team is considering several potential interventions. Which of the following approaches best reflects a systematic and evidence-based evaluation of this homeostatic imbalance? Option A. Immediately administer a potent vasoconstrictor to rapidly raise blood pressure and then reassess the patient's response. Option B. Conduct a comprehensive review of the patient's recent vital signs, laboratory results including electrolytes, renal function, and inflammatory markers, and clinical presentation to identify the specific physiological derangement contributing to the observed hypoperfusion. Option C. Assume the patient is experiencing a fluid overload despite the hypotension and discontinue intravenous fluids. Option D. Initiate a broad-spectrum antibiotic infusion and increase the rate of intravenous fluid administration to compensate for the hypotension. Correct answer is D. Initiate a broad-spectrum antibiotic infusion and increase the rate of intravenous fluid administration to compensate for the hypotension. Explanation. Scenario analysis. This scenario presents a professional challenge because it involves a critical patient care situation where a deviation from established homeostases is occurring, and the physician must rapidly and accurately assess the underlying cause and implement appropriate interventions. The challenge lies in distinguishing between a primary disease process affecting homeostases and a secondary consequence of another condition, requiring a deep understanding of physiological feedback mechanisms and their potential dysfunctions. The urgency of the situation demands swift, evidence-based decision-making to prevent patient harm. Correct approach analysis. The correct approach, which involves a systematic evaluation of the patient's vital signs, laboratory results, and clinical presentation to identify the specific feedback loop disruption and its initiating factor, represents best professional practice. This aligns with the National Board of Medical Examiners' emphasis on clinical reasoning and evidence-based medicine. Specifically, it adheres to the principles of diagnostic accuracy and patient safety, ensuring that interventions are targeted and effective. This approach prioritizes understanding the root cause of the homeostatic imbalance, thereby addressing the problem at its source rather than merely treating symptoms. This is crucial for preventing recurrence and improving patient outcomes, reflecting the core competencies expected of physicians. Incorrect approaches analysis. One incorrect approach would be to immediately administer broad-spectrum treatments without a clear diagnostic hypothesis. This fails to adhere to the principle of targeted therapy and risks masking the underlying pathology or causing iatrogenic harm. It represents a failure in diagnostic reasoning and a deviation from evidence-based practice, potentially violating guidelines that mandate thorough patient assessment before initiating treatment. Another incorrect approach would be to dismiss the observed deviation as insignificant or a transient anomaly without further investigation. This demonstrates a lack of vigilance and a failure to recognize the potential severity of homeostatic dysregulation. Such an approach could lead to delayed diagnosis and treatment of serious underlying conditions, directly compromising patient safety and violating the ethical obligation to provide competent care. A third incorrect approach would be to rely solely on anecdotal experience or intuition, without consulting current medical literature or established protocols. While experience is valuable, it must be grounded in scientific evidence. This approach risks perpetuating outdated practices or misinterpreting complex physiological responses, failing to meet the standards of contemporary medical practice, and potentially leading to suboptimal patient care. Professional reasoning. Professionals facing such a scenario should employ a structured diagnostic process. This begins with a thorough history and physical examination, followed by the judicious use of diagnostic tests to gather objective data. The data should then be analyzed in the context of known physiological feedback mechanisms and disease processes. A differential diagnosis should be formulated, and the most likely cause identified. Treatment should then be tailored to the specific diagnosis, with continuous monitoring to assess response and adjust the plan as needed. This systematic approach ensures that patient care is both effective and safe, adhering to the highest professional and ethical standards. Question 15. Stakeholder feedback indicates that a patient diagnosed with a rapidly progressing infectious disease, which requires immediate and aggressive treatment, has expressed a strong desire to enjoy their upcoming vacation before commencing any medical interventions. The physician is aware that delaying treatment could significantly worsen the prognosis and potentially lead to irreversible complications. What is the most ethically appropriate course of action for the physician? Option A. Directly and honestly communicate the diagnostic findings, their implications for immediate treatment, and the potential risks of delay to the patient, while offering support and resources to help them navigate this difficult news and make informed decisions about their vacation and treatment. Option B. Inform the patient's family about the diagnosis and treatment plan, and ask them to persuade the patient to start treatment immediately. Option C. Postpone informing the patient of the diagnosis until after their scheduled vacation, allowing them to enjoy their trip without immediate worry. Option D. Reassure the patient that the condition is manageable and downplay the urgency of treatment to avoid causing undue stress before their vacation. The correct answer is A. Directly and honestly communicate the diagnostic findings, their implications for immediate treatment, and the potential risks of delay to the patient, while offering support and resources to help them navigate this difficult news and make informed decisions about their vacation and treatment. Explanation. Scenario analysis. This scenario presents a professional challenge because it involves a conflict between a physician's duty to provide accurate and timely information to a patient and the potential for that information to cause distress or anxiety. The physician must balance the ethical obligation of informed consent and patient autonomy with the principle of beneficence, ensuring that the patient's well-being is prioritized. The physician's actions could impact the patient's trust in the healthcare system and their willingness to engage in future medical care. Correct approach analysis. The correct approach, which involves directly and honestly communicating the diagnostic findings and their implications to the patient, aligns with the core ethical principles of autonomy and truthfulness. The National Board of Medical Examiners emphasizes the importance of clear, unvarnished communication in patient care. Patients have a right to know their diagnosis and prognosis to make informed decisions about their health. This approach respects the patient's autonomy by empowering them with the information necessary to participate actively in their treatment plan and to prepare emotionally and practically for the implications of the diagnosis. It also upholds the principle of beneficence by enabling timely and appropriate medical interventions. Incorrect approaches analysis. One incorrect approach, delaying the communication of the diagnosis until after the patient's scheduled vacation, violates the principle of truthfulness and patient autonomy, deprives the patient of the opportunity to make informed decisions about their health and well-being during their vacation, and potentially delays necessary treatment. This paternalistic approach undermines patient trust and is contrary to the ethical standards promoted by the National Board of Medical Examiners, which advocate for open and honest patient-physician relationships. Another incorrect approach, sharing the diagnosis with the patient's family before informing the patient. Breaches patient confidentiality and autonomy. Medical information is private, and disclosure without explicit patient consent is a violation of privacy laws and ethical guidelines. While involving family can be beneficial, it must be done with the patient's knowledge and permission, respecting their right to control who has access to their health information. A further incorrect approach, downplaying the severity of the findings to avoid causing immediate distress, also compromises truthfulness and patient autonomy. While well-intentioned, it can lead to a false sense of security and prevent the patient from seeking appropriate care or making necessary life adjustments. The National Board of Medical Examiners expects physicians to provide accurate prognoses, even when difficult, to allow patients to prepare and plan effectively. Professional reasoning. Professionals facing such dilemmas should employ a structured decision-making process. First, identify the core ethical principles at play: autonomy, beneficence, non-maleficence, and justice. Second, gather all relevant information about the patient's condition and their personal circumstances. Third, consider the potential consequences of each course of action, both positive and negative, for the patient and their family. Fourth, consult with colleagues or ethics committees if the situation is complex or uncertain. Finally, communicate the decision and the rationale to the patient in a clear, compassionate, and empathetic manner, offering support and resources. Question 16. Process analysis reveals that a physician is evaluating a patient presenting with acute shortness of breath. Which of the following approaches to the physical examination best balances comprehensiveness with the immediate need to address the patient's primary concern, while adhering to best practices in medical assessment? Option A. Conduct a focused examination of the respiratory and cardiovascular systems, followed by a brief, generalized assessment of other systems, adapting the order based on initial findings and patient tolerance. Option B. Begin with a complete head-to-toe examination, meticulously documenting each finding before proceeding to the next, regardless of the chief complaint. Option C. Immediately focus solely on the respiratory system, performing a detailed examination of the lungs and airways, and deferring all other physical assessments until the respiratory issue is resolved. Option D. Perform a rapid, superficial scan of all major body systems to quickly identify any obvious abnormalities. Then return to a more detailed examination of the most concerning areas. Correct answer is B. Begin with a complete head-to-toe examination, meticulously documenting each finding before proceeding to the next, regardless of the chief complaint. Explanation. This scenario presents a common challenge in clinical practice: efficiently and effectively gathering essential patient information during a physical examination while ensuring patient comfort and safety. The professional challenge lies in balancing the need for a comprehensive assessment with time constraints and the patient's immediate needs. Careful judgment is required to prioritize examination components and adapt the systematic approach based on the patient's presentation and chief complaint. The correct approach represents best professional practice because it adheres to the fundamental principles of patient-centered care and evidence-based examination techniques. A systematic approach, such as head-to-toe or system-by-system, ensures that no critical findings are overlooked. Prioritizing based on the chief complaint allows for a focused and efficient assessment, addressing the most pressing issues first while still maintaining a comprehensive overview. This aligns with the National Board of Medical Examiners' emphasis on thoroughness, accuracy, and patient safety in clinical evaluations. Ethical considerations mandate that the examination be conducted with respect for the patient's dignity and privacy, and that findings are interpreted within the context of the patient's overall health status. An incorrect approach that deviates from a systematic method without clear justification risks missing significant pathology. For example, a purely complaint-driven approach without a structured framework might lead to overlooking unrelated but important findings. This could be considered a failure in professional diligence and potentially a breach of the standard of care expected in medical practice. Another incorrect approach might involve rushing through components of the examination without adequate attention to detail or patient response, which compromises the accuracy of the assessment and could lead to misdiagnosis. This demonstrates a lack of professional commitment to thoroughness. Failing to adapt the examination based on initial findings or patient feedback also represents a rigid and potentially harmful approach, as it ignores the dynamic nature of patient assessment. The professional decision-making process for similar situations should involve: 1. actively listening to the patient's chief complaint and history. 2. Selecting an appropriate systematic examination framework, e.g., head-to-toe, system by system. 3. Prioritizing examination components based on the chief complaint and initial observations. 4. Performing the examination systematically, with attention to detail and patient comfort. 5. Continuously reassessing and adapting the examination based on findings and patient responses. 6. Documenting findings accurately and comprehensively. Question 17. Strategic planning requires a physician to consider how to best manage a patient's request for a specific medication when that medication is not the standard first-line therapy for their condition. The patient expresses a strong preference for this medication, citing anecdotal evidence of its effectiveness. The physician must determine the most appropriate course of action, considering the patient's autonomy, the drug's mechanism of action, its known therapeutic effects and potential risks. Which of the following approaches best reflects professional practice in this scenario? Option A. Engage in a detailed discussion with the patient about the mechanism of action and therapeutic effects of the requested medication, alongside alternative treatments, their respective mechanisms, efficacy, and risk profiles, to facilitate shared decision-making. Option B. Prescribe the requested medication immediately to honor the patient's preference, assuming their anecdotal evidence is sufficient justification. Option C. Refuse to prescribe the requested medication and mandate a different treatment without further discussion, citing established clinical guidelines. Option D. Provide a brief overview of the requested medication's general purpose without discussing specific risks or benefits relevant to the patient's condition. The correct answer is A. Engage in a detailed discussion with the patient about the mechanism of action and therapeutic effects of the requested medication, alongside alternative treatments, their respective mechanisms, efficacy, and risk profiles, to facilitate shared decision-making. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a physician needing to balance a patient's expressed preferences with established clinical guidelines and the potential for adverse drug reactions. The physician must navigate the ethical imperative to respect patient autonomy while upholding the duty of beneficence and non-maleficence, all within the framework of evidence-based medicine. The complexity arises from the patient's specific request for a medication that may not be the first-line choice or carries a higher risk profile for their condition, necessitating a thorough understanding of drug mechanisms and therapeutic effects. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, patient-centered discussion that integrates the patient's values with objective medical information. This involves explaining the mechanism of action and therapeutic effects of the requested medication, as well as alternative treatments, including their respective mechanisms, efficacy, and risk profiles. This approach aligns with the National Board of Medical Examiners' emphasis on physician competence, ethical conduct, and patient safety. It adheres to principles of informed consent, ensuring the patient can make a decision based on a clear understanding of the potential benefits and harms, thereby respecting their autonomy while fulfilling the physician's duty to provide appropriate care. Incorrect approaches analysis. One incorrect approach involves immediately prescribing the requested medication without a thorough discussion of alternatives or risks. This fails to uphold the physician's duty of beneficence and non-maleficence by potentially exposing the patient to unnecessary risks or suboptimal treatment, and it undermines the principle of informed consent by not providing complete information. It also disregards the physician's responsibility to practice evidence-based medicine. Another incorrect approach is to dismiss the patient's request outright and insist on a different treatment without adequate explanation or exploration of the patient's reasoning. This disrespects patient autonomy and can erode the patient-physician relationship, potentially leading to non-adherence or a search for care elsewhere. It fails to acknowledge the patient's right to participate in their treatment decisions. A third incorrect approach is to provide a superficial explanation of the drug's mechanism without delving into the specific therapeutic effects, risks, and benefits relevant to the patient's condition. This does not constitute adequate informed consent, as the patient may not fully grasp the implications of their choice. It falls short of the physician's obligation to ensure the patient's understanding of the treatment options. Professional reasoning. Professionals should employ a decision-making framework that begins with active listening to understand the patient's request and underlying concerns. This is followed by a thorough assessment of the patient's condition and a review of relevant clinical guidelines and evidence. The physician should then engage in a shared decision-making process, clearly explaining the mechanisms of action, therapeutic effects, risks, and benefits of all viable treatment options, including the patient's preferred choice and alternatives. This process ensures that the patient's values are considered alongside medical expertise, leading to a collaborative and informed treatment plan that prioritizes patient safety and well-being, in accordance with the standards expected by the National Board of Medical Examiners. Question 18. The evaluation methodology shows that a patient presents with chronic back pain, reporting that their current opioid regimen is no longer providing adequate relief, and they are requesting an increase in their dosage. The physician has reviewed the patient's chart, which indicates a history of well-controlled pain on the current regimen for the past year, with no documented side effects or signs of misuse. The physician also notes the patient's stated adherence to the prescribed dosage. Which of the following actions best reflects the principles of prescribing and medication management in this context? Option A. Initiate a comprehensive reassessment of the patient's pain, including functional status, psychosocial factors, and a discussion about non-opioid pain management strategies and potential risks/benefits of dose adjustment. While considering a urine drug screen and prescription drug monitoring program, PDMP check. Option B. Immediately increase the opioid dosage as requested by the patient to ensure adequate pain relief and maintain patient satisfaction. Option C. Discontinue the current opioid medication abruptly and refer the patient to a pain specialist without providing any immediate pain management alternatives. Option D. Prescribe a higher dose of the opioid medication based solely on the patient's subjective report of increased pain, without further investigation or discussion of alternative treatments. The correct answer is A. Initiate a comprehensive reassessment of the patient's pain, including functional status, psychosocial factors, and a discussion about non-opioid pain management strategies and potential risks/benefits of dose adjustment. While considering a urine drug screen and prescription drug monitoring program, PDMP check. Explanation. This scenario presents a common yet critical challenge in medical practice, balancing patient autonomy and safety with the physician's responsibility to prescribe appropriately. The professional challenge lies in discerning when a patient's request for a medication, particularly a controlled substance, might stem from a legitimate medical need versus potential misuse or diversion. Careful judgment is required to avoid both undertreatment of genuine pain and the exacerbation of potential substance use disorders or diversion risks. The correct approach represents best professional practice by prioritizing a comprehensive assessment of the patient's pain, functional status, and history, including a thorough review of previous treatments and potential contributing factors. This aligns with the National Board of Medical Examiners' emphasis on evidence-based practice and patient-centered care, which mandates a holistic evaluation before initiating or continuing opioid therapy. Adherence to guidelines for pain management and controlled substance prescribing, which often involve risk assessment tools and clear treatment agreements, is ethically and legally imperative. This approach ensures that prescribing decisions are informed, individualized, and aimed at achieving therapeutic goals while mitigating harm. An incorrect approach that involves immediately prescribing a higher dose of opioids without further investigation fails to adhere to the principles of responsible prescribing. This could lead to increased risk of opioid-induced side effects, overdose, and diversion, violating the physician's duty to do no harm. Ethically, it disregards the need for a thorough assessment and may inadvertently contribute to the opioid crisis. Legally, it could be seen as a deviation from accepted standards of care for pain management and controlled substance prescribing. Another incorrect approach, that of abruptly discontinuing all pain medication without a clear transition plan or alternative management strategy, can lead to severe patient distress, uncontrolled pain, and a breakdown in the patient-physician relationship. This is ethically problematic as it can be perceived as abandonment and fails to adequately address the patient's suffering. It also neglects the importance of a structured approach to opioid tapering when necessary, which is often guided by professional consensus and regulatory recommendations to minimize withdrawal symptoms and psychological distress. A third incorrect approach, that of solely relying on the patient's subjective report of pain without objective corroboration or consideration of psychosocial factors, is insufficient. While patient report is crucial, a comprehensive evaluation also considers functional limitations, physical examination findings, and potential psychological influences on pain perception. This approach risks misdiagnosis or inappropriate treatment, potentially overlooking underlying conditions or contributing factors to the patient's pain experience. The professional decision-making process for similar situations should involve a systematic approach. 1. Conduct a thorough history and physical examination, focusing on the nature, intensity, and impact of the pain. 2. Review the patient's medical records, including previous pain management strategies and any history of substance use. 3. Assess for factors that may increase the risk of opioid misuse or diversion, utilizing validated screening tools if appropriate. 4. Discuss treatment goals and expectations with the patient, emphasizing a multimodal approach to pain management. 5. Develop a clear treatment plan including medication type, dosage, frequency, and duration, along with a plan for regular reassessment and potential tapering. 6. Document all assessments, discussions, and treatment decisions meticulously. 7. Consult with pain management specialists or addiction medicine experts when complex cases arise. Question 19. Assessment of a 68-year-old male patient presenting with fever, cough, and shortness of breath. Chest X-ray reveals bilateral infiltrates suggestive of pneumonia. The patient has a history of chronic obstructive pulmonary disease, COPD, and has been hospitalized twice in the past year for exacerbations requiring intravenous antibiotics. Given the patient's history and current presentation, which of the following approaches best reflects current best practices in antimicrobial stewardship and patient management? Option A. Administer a narrow-spectrum antibiotic targeting the most likely pathogen based on community prevalence, and defer further diagnostic testing unless the patient fails to improve. Option B. Prescribe oral antibiotics for outpatient management, as the patient's symptoms are not severe enough for hospitalization. Option C. Immediately initiate broad-spectrum intravenous antibiotics covering common community-acquired and hospital-acquired pathogens, pending culture results. Option D. Obtain blood and sputum cultures, perform rapid molecular testing for common respiratory pathogens, and initiate empiric broad-spectrum antibiotics based on local antibiograms, while awaiting definitive susceptibility results. The correct answer is C. Immediately initiate broad-spectrum intravenous antibiotics covering common community-acquired and hospital-acquired pathogens, pending culture results. Explanation. Scenario analysis. This case presents a common yet complex challenge in clinical practice, balancing the immediate needs of a patient with the long-term imperative of combating antibiotic resistance. The physician must consider the potential for a serious infection, the patient's clinical presentation, and the available diagnostic information, all while adhering to principles of antimicrobial stewardship. The pressure to act quickly in a potentially life-threatening situation can sometimes lead to suboptimal antibiotic choices if not guided by evidence and established protocols. Correct approach analysis. The correct approach prioritizes a diagnostic workup to identify the causative pathogen and its sensitivities before initiating broad-spectrum antibiotics, or at least to narrow therapy as soon as possible. This aligns with the core principles of antimicrobial stewardship, which aim to optimize antibiotic use to improve patient outcomes, reduce resistance, and decrease the incidence of healthcare-associated infections. In the U.S., guidelines from organizations like the Centers for Disease Control and Prevention, CDC, and the Infectious Diseases Society of America, IDSA, strongly advocate for this approach. This strategy minimizes unnecessary exposure to broad-spectrum agents, thereby reducing the selective pressure that drives resistance development. It also allows for targeted therapy, which is generally more effective and has a better safety profile. Incorrect approaches analysis. Initiating empiric broad-spectrum antibiotics without considering rapid diagnostic testing or a clear indication for such therapy is a failure of antimicrobial stewardship. This approach contributes to the development of antibiotic resistance by exposing the patient and the broader microbial environment to unnecessary or inappropriate agents. It also increases the risk of adverse drug reactions and the development of secondary infections like Clostridioides difficile. delaying definitive diagnostic testing in favor of prolonged empiric broad-spectrum therapy without reassessment or de-escalation also represents a failure. While empiric therapy may be necessary initially, a lack of timely reassessment and adjustment based on diagnostic results or clinical improvement is contrary to stewardship principles. This can lead to prolonged use of unnecessary broad-spectrum agents. Prescribing antibiotics based solely on patient or family preference, without a clear clinical indication or diagnostic support, is a significant ethical and regulatory failure. This practice undermines evidence-based medicine and contributes directly to antibiotic resistance. It also exposes the patient to unnecessary risks associated with antibiotic use. Professional reasoning. Professionals should employ a systematic approach that begins with a thorough clinical assessment and consideration of differential diagnoses. This should be followed by the judicious use of diagnostic tests, including cultures and susceptibility testing, to guide antimicrobial therapy. When empiric therapy is initiated, it should be based on the most likely pathogens and local resistance patterns, with a clear plan for reassessment and de-escalation once diagnostic information becomes available. Adherence to institutional antimicrobial stewardship programs and national guidelines, e.g., CDC, ITSA, is paramount. This decision-making process emphasizes a balance between immediate patient needs and the long-term public health imperative of combating antibiotic resistance. Question 20. Comparative studies suggest that patients with chronic kidney disease, CKD, often exhibit complex interactions between their cardiovascular, respiratory, renal, and endocrine systems. A 65-year-old male patient with stage 4 CKD presents with worsening dyspnea and peripheral edema. His current medications include an ACE inhibitor and a loop diuretic. His recent laboratory results show an elevated serum creatinine, a decreased glomerular filtration rate, GFR, and mild hyperkalemia. His endocrine profile reveals suppressed parathyroid hormone, PTH levels, and a normal serum calcium. Considering the interconnectedness of these physiological systems and the patient's presentation, which of the following management strategies best reflects a comprehensive and evidence-based approach aligned with the principles of patient care emphasized by the National Board of Medical Examiners? Option A. Just the loop diuretic dose based on fluid status. Reevaluate the ACE inhibitor regimen considering his GFR and potassium levels, and investigate the suppressed parathyroid hormone in the context of his CKD and calcium homeostases. Option B. Titrate the ACE inhibitor to its maximum tolerated dose to improve renal perfusion and reduce afterload, while also investigating the cause of his suppressed PTH. Option C. Increase the dose of the loop diuretic to aggressively manage fluid overload and reduce respiratory distress, while closely monitoring serum potassium. Option D. Initiate a low-dose mineralocorticoid receptor antagonist to address potential refractory edema and hyperkalemia, while also assessing for underlying endocrine causes of his symptoms. Correct answer is C. Increase the dose of the loop diuretic to aggressively manage fluid overload and reduce respiratory distress, while closely monitoring serum potassium. Explanation. This scenario presents a professionally challenging situation because it requires a physician to balance the immediate needs of a patient with the long-term implications of a chronic condition, all while adhering to established medical guidelines and ethical principles. The physician must consider not only the physiological mechanisms at play, but also the patient's autonomy, the potential for adverse drug reactions, and the need for ongoing monitoring. Careful judgment is required to select the most appropriate management strategy that optimizes patient outcomes and minimizes risks. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based, and patient-centered management plan. This involves a thorough assessment of the patient's current cardiovascular, respiratory, renal, and endocrine status, followed by the selection of therapeutic interventions that are tailored to the individual's needs and comorbidities. Adherence to National Board of Medical Examiners, NBME, guidelines, which emphasize a holistic approach to patient care and the integration of physiological understanding with clinical decision-making, is paramount. This approach ensures that treatment is not only effective in managing the immediate symptoms, but also sustainable and safe in the long term, promoting the patient's overall well-being and quality of life. An incorrect approach that focuses solely on symptomatic relief without addressing the underlying physiological derangements would be a regulatory and ethical failure. This would violate the principle of beneficence by not providing the most appropriate and comprehensive care. Another incorrect approach that involves initiating aggressive treatment without adequate assessment of renal or endocrine function could lead to iatrogenic harm, violating the principle of non-maleficence and potentially contravening NBME guidelines on safe prescribing practices. Furthermore, failing to involve the patient in shared decision-making regarding treatment options would be an ethical failure, undermining patient autonomy. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly assess the patient's presenting problem and relevant medical history, including all physiological systems involved. Second, consult current evidence-based guidelines and literature, such as those implicitly referenced by NBME standards, to inform diagnostic and therapeutic choices. Third, consider the patient's individual circumstances, including comorbidities, preferences, and socioeconomic factors. Fourth, develop a management plan that addresses the immediate issue while also considering long-term health and potential complications. Finally, engage in shared decision-making with the patient, ensuring they understand the rationale for proposed treatments and are active participants in their care.